Magic makers, I absolutely love when I can find great resources for you. And today I have found a great resource. I'm talking to Dr. Herman Weiss, and we're talking about PCOS, but we're also talking about how PCOS may have impacts on to menopause. And Dr. Weiss has spent his life as an OBGYN as well working on how do women deal with hormone abnormalities. And I don't know about you, but so many women I come across, we're doing fine, but then all of a sudden we get this curveball thrown at us, and our doctors are kind of like, I don't know what to do with you. And so that's where we have Dr. Weiss here for those people who like get that pregnant pause and feel like they're off chasing their tail. Dr. Weiss, please welcome to the show.
Oh, thank you so much, Kim. I love the energy. I listened to a few of your podcasts already, and I was very excited to be here and channel some of that positivity.
Awesome.
It's funny when when you say PCOS and polycystic ovary syndrome, you think of a young, a reproductive age population, but in all honesty, a lot of women go through life undiagnosed. In fact, about
Yes.
70% of patients and go undiagnosed. It's the number one endocrine disorder in women, by far. By far, if you have a room of 100 women, you're going to find between 10 and 15 have some shades of PCOS, and it's rampant. And the reason why it's so rampant is that it has a very amorphous presentation. There's many things that can come up. Some women look like this, some women look like that, and there's not one size fits all. And also, patients who are now finished with their reproductive years may say, well, I don't have PCOS because I had 3 kids or I had 2 kids and I conceived without an issue. And that may not be the case. And so yeah, it's definitely very, very important. And I'm fortunate because I see patients even in their teenage years,
Mm,
all the way into their postmenopausal years, and I try to put little nuggets into their head when they're younger about what they can expect later on.
yeah.
And
And
so, talking to you about these golden years, so to speak, is it's a real big challenge, but it's a challenge that takes patience, energy, and
mm.
positivity.
Absolutely. So let's just take a big step back. So I know that many people we've heard those four letters before, right? And so you spelled it out, polycystic ovarian syndrome. What exactly is that for someone who's like, I know I've heard that acronym before, but I have no idea what the hell it is.
What's funny, even take a step further back, it's actually polycystic means many cysts, but they don't have many cysts on their ovaries. They have many small follicles around their ovaries. And so people say, well, I got an ultrasound and the sonotech said I have a
Mm.
lot of cysts on my ovaries, and they all start freaking out. And they do got Dr. Google. So basically, there's a three-pronged approach to how patients diagnose themselves or are diagnosed with PCOS. And and I also believe that we are on a pendulum in life. We're not like in one box or one silo, and we kind of shift in and out. So the three-pronged approach that you need, Rotterdam criteria, whatnot, and basically one is irregular cycles,
Hmm.
okay, where their menstrual cycles are irregular, too much bleeding, too little bleeding, no bleeding at all. And that as a result has a problem with ovulation, and the
Mm.
ovulation may lead down to trouble conceiving. Now,
Right.
I'm very careful to say that because if someone gets the diagnosis of PCOS and they Google it, again, it says infertility. And
Right.
I want to make sure that that doesn't get conveyed improperly. Everyone is individual and everyone's unique and everyone's themselves, and it has to be applied to them by
Mm.
their healthcare practitioner. But the infertility issue is that it's not that they're infertile and they can never have kids. Sometimes they take a little bit of a push on this
Right.
side or a little push on that side. So that's the first one. It's about their menstrual cycles. The second one is they have something called hyperandrogenism. Now that means that you as a woman have male hormones by definition, and then me as a man have female hormones, but mine are down there and yours are up there. So you have different ratios and I have different ratios. In a woman with PCOS, she has something called hyperandrogenism, which is elevated male hormone levels.
Mm.
Her testosterone is up, her DHEA is up, her androstenedione, 17-OHP. Some of these things may be common to some people. People may have no idea about what I'm saying, but basically it's the male hormones, and as a result of the male hormones, this plays a role in that difficult ovulation spiral, whether it's cause
Right.
or effect, it's hard to say. But what happens is they start losing hair where they want hair growth, or they have hair
Right.
growth in their face, chest, and shoulders, maybe, and stomach where they don't want hair growth. So
Right.
it's, hair issues, acne. They sometimes get these patchy spots on their backs and whatnot, and skin manifestations. So that's the hyperandrogenism. The third thing to make the diagnosis is that what we touched on is they get a sonogram and they see multiple small follicles on the ovary, and they see that the ovaries are filled and filled and filled with eggs, but they're not letting go of that one egg once a month. And so when they present, and very, very often they'll go to 2 or 3 doctors, or they'll go misdiagnosed or undiagnosed for many years. And then when they show up and they're like, yeah, this is what's happened and this is how it's been developed. So PCOS is the take-home message, is the most common endocrine disorder for women.
Mm.
It should never be overlooked. And I get a few problems I get with my patients is they come to me and they say, well, my doctor says I definitely don't have it now, or I definitely do have it, or I definitely am infertile. And it pains me
Right.
to
With that
a great
definite
extent.
word.
That word, exactly. When you come in here and you have that, you come in here, patients are very sensitive, and I'll share a story with you
Yes.
later on about that. But you have to be so careful with what you say. If you're a healthcare practitioner, if you're a
Right.
doctor, you have to be so careful. So when you start saying those words like definite this, definite that, I'm like, take a step back. Let's talk about facts. Let's talk
Right.
about what you're doing. Let's
Because
talk
I
about what you're
take
trying
it.
to accomplish. Yeah,
I take it and
yeah,
it's like it's the gospel. Like my
yeah.
doctor told me X and it is the gospel. And if you're someone like me, a questioner, you might get that second opinion, or you might go home and you're like, I'm destined to never be a mother, or I'm destined to whatever they told you it is that your definite diagnosis was.
Yeah, it's really painful. And so a lot of the stuff I do in my office is walk them off the cliff, walk them back, trying to get
Yes.
back to, why did that doctor say that? Well, maybe he or she was saying this because of this. Maybe he or she was saying this because of this. And you kind of have to like really guide them into like, oh, this is the understanding. Oh, these are the things that I can do to make a positive change. Because once you give them that diagnosis, or you say that you're trending towards, or then these are the things that can guide you out of it.
Right.
And once you educate them and
Yes.
empower them, and I think that's
Yes.
a lot of what you're doing on your show, is you're actually education and you're empowering. And I think that that's wonderful. And that's why I wanted to come on the show, because I felt like I said to you earlier, there's great energy, there's great education. I know that you have your followers and your clients, and I think that that's really what you have to emphasize. That sometimes you take a step back. Sometimes like last week, like I also I'm trying to exercise more. I'm trying to lose weight, and I'm in my 50s. And if I don't eat well for a week, my scale goes up, and I'm like,
Right.
darn it! I worked for 3 months to move it down like this, and then all of a sudden I had a bad week and it goes up. And you know what? I biked this morning, 30K, and you just got to get out there and do it, because every day I always say is a part of in the war. It's like a battle, and you got to eat right and you
Yes.
gotta exercise, and you got to try to save the day. And at the end of the week, you try to have more wins than losses. So it's exciting to be part of this.
Absolutely. So now, like, as you mentioned, so what if I'm that 70% of the women out there? And because everything you just described is as far as PCO minus the getting the CAT scan. But I think about like I know in my
100%.
20s, there were plenty of times I had irregular periods. There are plenty of times that some of us are like, well, I'm just, my whole family is hairy. You just kind of
Right.
like there are little things that you kind of dismiss because yeah, you're like, I'm stressed out, or I'm this, or I'm that. And you just kind of start to discount that. Are there, as people start to think about what you just said, you're like, oh, could I potentially have PCOS, or could, like you say, trending towards that?
Yeah, that's a great question. And I want to kind of like level set what a normal menstrual cycle is, or what a normal year of reproductive health is. There's so many things that have to happen when someone's not on the pill, when someone that have to have the brain tells
Mm-hmm.
the ovaries to tell the uterus and there's about a million things. If I drew you the cascade that has to happen for an effective menstrual cycle, for an effective ovulation that would either induce a pregnancy or lead to a pregnancy or lead to a menstruation, you're like, oh my God, how does anyone ever ovulate? How does anyone ever get pregnant? And it's a
It's
miracle. And
it is funny because, like, I mean, if you think about like what like us lay people are taught, what in eighth grade health class is that basically the first time you ever have sex, you're gonna have a baby. Like that is how it is explained to us. Like it
right,
is like
right,
the like every single time you have unprotected sex, you're gonna have a baby. And
right,
meanwhile,
right.
everyone who here is listening who's tried that method, they're like, ain't happened to me. I had sex 100 times and I
Right.
still needed some help.
So when a patient comes to me and she says she has irregular bleeding, I kind of get a little bit of a history. I find out, her stress levels, because the brain also talks, one
Mm,
part of the brain talks to another part of the brain, talks to the thyroid, talks to the adrenals. So then you're talking about stress, and then the stress it has positive feedback or negative feedback. And so and during the month, the first part of the cycle is estrogen dominant, and then there's something called the LH spike, and the LH surge causes the ovulation. And so it's such an intricate detailed and delicate
yeah.
flow that I'm sorry about the word flow, but give and take, that any one thing that goes off, somebody traveled, someone had a stress in her life, that it's not uncommon, and actually it's very common for a woman not on birth control or anything like that to miss 1 or 2 periods a year. It's
Yeah.
or have irregular bleeding. That is normal. Doesn't mean that she's got PCOS.
Right.
So now, but when she starts saying, well, then you start getting the history and say, well, we have been trying, I haven't been successful. I get my period every 2 to 3 months, and it's like a longer period. Then you start scratching your head, and then you start saying, hey, this may be she's not ovulating. This may be that she's having difficulties. This may be that, then you start doing some blood work and whatnot. But not every missed period it means that she has PCOS.
Gotcha.
And also, I believe that, as I mentioned, we live on a pendulum. And if you're
Mm,
doing the right stuff on the right diets and the right exercises and the right nutrition and doing the right stuff, I think that you can move that pendulum away from the edge, right,
right,
into
right.
into the non-PCOS. But if you're a PCOS trending person and you kind of go, then you're over on the edge and you're over the edge, and then all of a sudden you're not having the cyclicity that you're looking for.
Right.
So sometimes you don't need to go all the way to the far end to cure yourself. You just need to kind of drift over a little bit. And I think that there's a lot to be said for like making minor changes and doing things the right way. So it's the big picture, and I try to identify with the patients and what they want. Now, one of the biggest problems in the PCO diagnosis is when a patient walks into the office, the doctor, who now, as you're well aware, has less and less and less time to actually talk to the patient.
Yes.
So the doctor walks in, and the patient walks in, and the doctor like knows within a few minutes that this patient has PCOS. It says, "We'll check your bloods, we'll check your labs, we'll check your ultrasound. Do you want to get pregnant? No. Here's birth control pills. Do you want to get pregnant? Yes. Here's infertility." And then I'm like, oh my God, like that's so bad because they're not talking to the patient, or even worse. You want to hear the worst thing they say to them? You ready?
What?
I think you're going to know this. Oh, just lose weight and you'll be okay.
Oh,
And that
yeah.
is as damaging as it gets.
Yeah.
Um,
Lose weight or
and
stop eating. Like my doctor told me to stop eating sandwiches.
oh, smart. That's a brilliant thing to say. That's
Yeah. And
just
I
eat
was like,
cool mountain water.
yeah, I had to sit on my hands. I was like, oh my God, I'm going to jail today. Like I was just
Yeah.
so like pissed.
Yeah. So those are not helpful, because I think that we as a society want a quick fix, quick fix, quick fix,
Yes.
but it didn't happen overnight. It's not going to get better overnight. And
Say that
so
again. Say that again.
I
What
said,
what what what
I
what
said, yeah, it didn't happen overnight. It's not going to get better overnight.
Ladies, did you hear that? Like I want you just to take that snippet and like put it on some type of audio device and just repeat it every single time you want something to happen overnight. Nothing happens
Yeah,
overnight except for like
yeah.
sunlight and moonlight. That's the only thing that happens overnight.
Yeah, so I get that a lot, and I try to re-emphasize that. And then, like I said, those baby steps, like just trying to make good habits and trying to put things that are together and doing things that you like.
Mm,
I have a whole, presentation I give to my patients who are actually in the PCOS world. I go through the diagnosis that we just went through, actually the presenting symptoms that the patient sitting in front of me has, and like we go through this different symptoms, then we go through the diagnosis, and then I go through the different causes of PCOS, and there's 3/4 different types of PCOS, but not everyone has one. Everyone could have multiples, right? And then I go through what you actually can do that you can actually do. And I go through the nutrition and the diet and the exercise and the mental wellness and the microbiome and the supplements. And then eventually the end of the circle, the end of my seventh pillar, I call it, is medication, because sometimes they will need medication. And ultimately they may need a birth control or they may need infertility work. But there's so much to do to get up to that, that anything you do, and if you make ownership of any of those circles as you go through the pillars, you actually, everything you do from then on is going to be more effective.
Right.
And so it's really and it's something that particularly pertains to your patient population. Is PCOS does set patients up for downstream complications of life. Okay,
Mm.
and they need to know about it early, and I tell them about it early, and I tell them about it, and I ask them about it, as they come to me and they're having the irregular periods later on in life, that maybe she did have shades of PCOS,
Mm.
maybe she did, so they're at risk for heart disease, they're at risk for metabolic syndrome, pre-diabetes, type 2 diabetes. There are some other issues that are some different types of cancers, like endometrial cancer, they're at risk for. So it's you can't just look, with your blinders on and say, hey,
Right.
you came to me because you want to get pregnant, you have PCOS. No, you have to say, hey, if you have PCOS, you have to do some real lifestyle changes that will affect you, because you'll get pregnant, you'll have a kid, you want to take care of that kid, and for the rest of a long life, and enjoy it, and dance at her wedding or his wedding, and walking down the aisle healthy.
Right. So
Um,
let's take a step back. I really liked what you said because I think most people, and you probably see this in your practice, they want you to give them like, here's the magic pill, right? Here's the
right,
magic pill and everything's going to go away. But yeah, I loved how you said there's a pillar approach that you're looking at it. Okay, we're going to start here and see how that works. And then if that doesn't
right,
work,
and build.
we go from another place to another place to another place. And for those of you guys listening, like this is what you want from a doctor, right? You want them to
Yeah,
have like, no, like, okay, everyone's different. You're like, I can have, like he said, that pendulum. I could be like knocking on the teetering edge of PCOS, or I could be just like at the beginning of my PCOS journey. And he's going to treat me differently. And I'm going to do different tweaks to get me to get into that more center part of that pendulum. And I really like that approach. And I want you to think about that when you're talking to your doctor or you're trying to get to this diagnosis, that it's not going to be this like magic pill and you're sent out on your way.
yeah. I think it's a great point you're making, and I think that that's a mentality that, so it's not just the doctors are not talking to patients or educating their patients anymore. Patients are very demanding, and they want
Yes.
one pill to fix everything. And I think there's a give and take for both of them. That not only do doctors need to talk more to their patients and be more bring on the education more and be more of a partner with them, but also the patients need to step up also and say, hey, I'm gonna change some of my lifestyle and my more of a holistic approach, and maybe get some more medications to help. But I'm not looking for that medication, that one shot that can reverse everything. And I think that's a partnership really, and that partnership is I'm gonna do the medical side, you're going to do your side, and we're going to bounce it. I may be wrong, I may need to adapt it here or there, I may put you on the wrong pill, I may need to change it, but as long as we have open communication, we're going to get through this together. And the data shows that it works. That approach
Yeah.
really works.
And I'm fortunate that I do have a partnership with my doctor because I ask a lot of questions. And but the best thing always can give advice to people going into a doctor in these situations: write your questions down. Like just write them all down, because so many times I know that like you'll say something to me and it doesn't really sink in, but I know that this is what I've been thinking about, what I've been questioning, and if I write it down before I go in, I don't blank. Like physically, I come in with a piece of paper if you need to put it on your notes app, whatever, so that you can ask the questions and not feel like, and if you feel dismissed
Right.
by your doctor, it's time to get a new
Get
doctor.
get a new doctor. Yeah. I can't, I tell it, well, I have a fairly large pregnant population as well. And I tell them, I'm going to see you in 4 to 6 weeks from now. Please just write it during the month. If it's not urgent and you have questions, please write them down and come in with your list. It's critical, because the second they walk out, like when you're in front of that doctor, that's your time. You have my
Yeah.
undivided attention. I have all your labs in front of me. I have everything, and you have my undivided attention. I will answer all your questions. That can burn you a few times because there are patients out there that can,
Right. Hang
that you have
on.
to be that you have to be able to get some balance in. But yeah, it's definitely it's your time, like I said, and that's what I'm there to do. Because the bottom line is, a better educated patient about
Yes.
the process, and I don't want to say disease process, by about the medical aspects of their life and how it applies to them, because a lot of them come in with their friend said this and their friend said
Mm,
that and their friend liked that pill and their other friend like and I hate that pill and I don't care about everybody else.
right.
If you're that one of 1,000 sitting in front of me, I only care about you. So yes, knowledge is good, but we have to adapt it and train it for you. And so an educated patient is a much more compliant patient. If she
Yes.
understands that every time she does that exercise regimen, this is what it's doing in my body
Right.
specifically, then yeah, then I'm going to win, and that patient's going to be more compliant. And that's not even news. That's published data. And also having more touch points with your doctor and being in touch with them. But the compliance is a huge issue because you get into these exercise regimens and you download this app and go into this place and you do it for 2, 3, 4, 5 weeks. It's just it wears off.
Right.
And so you have to find something that you like and keep with it.
So you mentioned that for people who might already have this diagnosis, that there's some lifestyle changes that need to happen if you do have PCOS. What are some of those lifestyle changes that need to happen?
Okay, great. So I'll take it one step back. When we make the diagnosis that there's 3 to 4 different types of PCOS, and again, there's a lot of overlap between the two.
Hmm.
Predominantly, the number one cause of PCOS, and up to 80%, is something called insulin resistance, which you may
Yep.
have heard about, which you may have
Hmm.
spoken about. We could spend weeks and weeks and weeks and only scratch the surface of insulin resistance.
Yep.
You may be familiar with insulin resistance as it overlaps with type 2 diabetes,
Right.
okay? And there is a lot of overlap with someone with PCOS with type 2 diabetes and metabolic syndrome later on in life. And that's something that, she just say, that's important, need to know about that. And then there's the next one is called adrenal PCOS, where their stress hormones are very high. It's like glucocorticoids that, because we all have stress hormones and if we have a lot of high level of stress, that actually can it have a negative impact on the ovarian production of hormones and put you into a PCOS scenario. So that's the second one. Again, about 5 to 15%. And then the third one is inflammatory, where you have a lot of pro-inflammatory markers in your body. Your C-reactive proteins are high, and you have a unhealthy gut microbiome, and that's like spewing off a lot of pro-inflammation and leaky gut syndrome, and all the inflammation kind of is circulating, and it
Hmm.
actually goes to the ovary, and it makes it more difficult to ovulate, and the surface of the ovary becomes inflamed. And so if they don't ovulate, they get that whole cascade again. So then I say, okay, let's assume you're in the insulin resistance, or you could be adrenal, and Tuesday you could be the adrenal, Wednesday you could be the the inflammatory, and Thursday you could be the insulin resistance. So it really doesn't matter to me because I go down into my Venn diagram and I say PCOS at the middle. What can I do as a patient that can reverse that? And so I start in the first circle. I write diet. I go every week. I'm telling you, I'm sitting in my office now. I have piles and piles of papers that I read, that I get into my inbox about this diet working and this diet working
Yes.
and that diet
Yes.
working. I'm
Yes.
sure you see. I'm sure you see it in the
Yeah.
alerts and stuff. And that stuff is great, but it drives me crazy because patients. I hate that diet culture. If I do this
Mm,
diet, it like it'll cure me of this, that, and the other thing.
right.
And I
It's gonna
think that
save me from myself.
yeah, and I really find I love that people are working on it and acknowledging it, but again, they have to get to the core of what's the underlying cause that you're actually trying to reverse, that then you're going to make the right choices in your diet. So I've seen, and again, the diet has to work for you. If
Yes.
it's too expensive, if it's too arduous, if you are, a double job working mom, et cetera, you're not going to be able to prepare. You're just going to go to McDonald's. It's just not going to work. We have to figure something else out for you. So as diets go, I've seen no, keto, slow keto, 30, 30, 30, intermittent fasting,
Yeah.
um, carnivore. That was big for a little bit. But the one that I'm most favorite of, because it's got the most beautiful foods, is the Mediterranean diet, and
Yep.
it has a lot of great data. If you just go into like PubMed and do Mediterranean diet and PCOS, you'll see amazing data on it. But if you look at any of these studies, you have to be very careful. Look at the sample size, and also look at the length of intervention. Okay, because these patients
Yeah.
are on it for a long time, like maybe 12 weeks before they start seeing an effect. But the diet is just one aspect of eating. I think the relationship with food is really
Yes.
important.
Yes.
So that's my next. So I don't tell a patient to take this diet or that diet. I kind of say that the core tenets of that box are finding a diet that works for you, that has the right scientific validity, basically decreasing your carbs and decreasing your the oil, the unhealthy oils, increasing your proteins, big picture type of things. I'm not going to write her a diet for her while she's in my office in 15 minutes. I think she's got to like learn about it, understand what she likes,
Right.
how it's good for her family. The next circle is nutrition. Now you're going to ask me, Herman, what's the difference between nutrition and diet? And I go, well, diet is what you eat. Nutrition is how you eat, where you eat, when you eat, why
Mm.
you eat.
Mm.
Okay. That the Friday night friend who calls you and out for drinks and a pizza,
Yep. And
and
it's only going to be one drink, and
right,
maybe
right,
yes, split
right.
an appetizer, and then the menu
And
comes.
I don't want you to abandon that friend. I think those are great friends to have, and I think that's very important to for your mental wellness. But maybe have a smoothie or something. Maybe have something else that's not, or fill up before you go. But just that the eating late, eating drinking alcohol not at the right times and whatnot. I don't want you to live a Spartan life, but just think about the timing. Eating late at night is also not healthy. It's been proven that if your glucose spikes after 8 o'clock, you have like 10% all your effective, like if you take someone who does the same exact thing in diet and exercise, but her glucose spike is before 8 o'clock, right? Then she has like a 5% improved weight loss than the person who has those glucose spikes later on at night. So it's the timing of your meals as well. And when I talk about the relationship with food, you don't have to finish the plate. You don't have to eat until you can't eat anything else. You don't have to, like all these things that my mom used to train me. We got to finish everything on your plate.
Yes.
And so like we're starting to learn that those things are,
Right, because there was
but
always some
that's
starving person in some other country.
somewhere you're wasting. Like we're just gonna throw it out anyway. What is So then
Right.
it'll sit with me forever. So that's important. The next thing is going to be a little bit interesting that you may or may not know about. Something called food order.
Mm.
Are you familiar with food order?
It's funny. Are you familiar with the woman? She wrote a book, Glucose Goddess.
Oh, I think I've heard about that. Yeah.
Yeah, so she was one of the first people that I heard about that whole order of food. And so it was one of those things where you're kind of like, is this kind of pseudoscience? And so you kind of like dive into the rabbit hole.
Yeah. It's not pseudoscience.
No,
It really makes a difference. It makes a difference. And I'll tell you, like if you ever go out for sushi and you eat the sushi, I'm always hungry an hour later,
oh yeah,
right? Because when you eat the rice first, so let's just say you have a plate of rice, broccoli, avocado, and chicken breast. Healthy protein, healthy carb, healthy fiber, healthy fats, right? And you eat the rice first, that spikes your insulin. Your
right,
insulin spikes because your insulin sees that big carb load and says, "Hey, I have to deal with this." Then you eat everything else, and then it'll drop your sugars precipitously because your insulin was so high. You're not in any danger because you're not a diabetic, but
right.
but it drops it, and an hour later you're hungry again and you're craving again. So one of the number one symptoms of PCOS is craving, and that's why they're
Mm.
just not eating properly. So it's you have to prevent that insulin spike. And so you want to eat the complex carbs, you want to eat the fiber, you want to eat so you get that very muted insulin elevation. If you get that muted insulin elevation, you're going to get a muted glucose curve, and it's going to carry you longer. And the more proteins you eat is going to carry you longer in terms of your satiety. So you're not going to have to like, binge and do I say foraging. I
Oh
stand in
yeah.
front of my
Hmm.
pantry and I forage, like in the forest.
Right. I always, one of the big things I always tell my clients is that a lot of people find they end up foraging because they denied themselves something. So like, oh, I'm not going to have whatever it is, the pizza or the whatever it is your thing is. And I'm always like, have that piece of pizza or that slice of cake, because in your mind, you're keep looking for that cake or the pizza, whatever. And so you're in that cupboard chasing that taste.
Right. And eating at midnight or 10 o'clock is much, much worse than having that pizza at 7. It really
Right.
is. I mean, I'm not, again, don't say, well, Dr. Weiss said to have pizza at 7. That's okay. I'm saying let's just think
Right. If
about what the downstream
you know,
effects are. Yeah.
we all don't crave pizza every day. But that time
Right.
that like if you're sitting down with your family and they're having pizza, have that slice of pizza versus like, I'll just have my kale salad while you guys have your
Yeah.
pizza.
Right. Yeah. Yeah. It's painful. It is that when everyone else is around you doing, and that's what that relationship with food and friends and whatnot. But um, one of the other thing, what was the other thing? Oh, so the next thing I talk about is exercise, and again, I love the internet. I hate the internet. I love social. I hate social. It's like sometimes those people out there could be so
Mm,
toxic.
yes.
Toxicity. Don't do this. Never do this. Always do this. Oh my God. It'd be
Yeah.
like you just go, I can't do anything.
And
It's
they're so convincing because like in your mind you're like, oh my God, like I've been doing it all wrong for all these
all
years.
wrong. Exactly. So I try to see the patient sitting in front of me and say, listen, I know you got to get one kid to kindergarten, another kid you got to do here, and they got to pick up over here and soccer with this and moms. And I go, you have to work something into your schedule that you like to do, so you'll
Yes.
do it. Okay.
Yes.
Now, one of the things I have not gotten off of, but like CrossFit. Now, there are
Mm,
people that are addicted to CrossFit. And let me tell you, CrossFit is actually it's pro-inflammation. It gets a lot of inflammation in the body. And
yeah.
that's part of like, wow, if you're going to cause all that inflammation, it's going to have the negative effect on the PCOS. And I go, da, 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 da. And the bottom line is that if you're addicted to an exercise, do it.
Right.
Do it. I don't want to change that. Maybe you can alter some of the high impact stuff so you're not causing so much inflammation, but definitely do it. There's a great camaraderie there. There's a great uplifting. So there were times where I was saying, don't do CrossFit, just do so and so. But I'm like, I'm off that. I'm like, if you like it and you're addicted to it, that's the best thing that can happen to you.
Yeah. And
Yoga, whatever it is, it's something that's really, really important.
you're right, because I feel like people in my field will be like, you shouldn't go to F45 and CrossFit and Orange Theory, it's the
Yeah,
devil. And then I'm like, but if I like that stuff and it's going to get
right,
me to go, then great. Now, instead of telling me not to do it, how do I sprinkle it in? So instead of going to
right,
CrossFit 7 days a week, maybe it's like, hey, could we scale it back? Maybe we go to 5 days a week. Can we go to 4 days
right.
a week? So we give our
And
body
then
some,
fill in something else. Yeah,
right.
yeah.
But it's like we are just more about like the no's than the like, how do we find a balance?
Yes, yes. And I think that's the critical key there is the balance. Because the no's are it's so painful to hear that advice because it's so bad to say don't do something when like it's actually good for them.
Right.
So what I tell my patients, I say 3 to 4 days a week of 45 minutes to an hour of getting that heart rate up there, doing some cardio, try to find something like walking, running, biking, cycling, even Pilates. I'm a big fan of Pilates. I'm a big fan of because of the core strengthening
Yep.
and the pelvic floor
A
because
pelvic
after
floor
either
for sure.
deliveries,
Yes.
as women age and go through the estrogen drops, it becomes a real issue. And I try to tell
Mm.
my patients all the time, and also the patients that are trying to get pregnant. I say the best thing you do is be healthy before pregnancy.
Yep.
Stay healthy during pregnancy because labor is challenging. And then we want you to bounce back as fast as possible, in post pregnancy. So it's really important to have that frame of mind. And then the next thing I talk about in exercise, in that circle of exercise, is post in the hour after you eat, doing some sort of 15 to 20 minutes of exercise. And I don't mean anything strenuous. I mean not going back to your computer and just typing on da 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 da, typing on the computer, not not just sitting down at the office and doing something. I'm talking about doing just body weight squats at your desk.
Yep.
I have in um my bag, where is it? Uh, Resistance bands. Now I could do a full body workout in 15
Yeah.
minutes, all the muscle groups. If a patient doesn't show up and I have 15 minutes, I'm able to do a full exercise. So the reason why it's so important, and sometimes it's just walking around your house, walking
Yep.
around your block, walking around your building, doing a couple flights of stairs in the hour after you eat. Because think back to what I said earlier about the insulin spike.
Yeah.
When that insulin spikes after you eat, it does one of two things. Okay, it will take and insulin is a protective enzyme or a protective hormone. It says, I want to save this energy, which is what you're eating. It's broken down to glucose. That's why when you eat something, it's broken down to glucose. The more complex it is, the harder and more energy you use to break it down, the better balance you have. Okay, like that whole glycemic index, which
Mm-hmm.
we didn't talk about during the diet, and but that was a very important topic that we probably could spend another hour on.
For
Um,
sure.
but when the insulin sees that glucose, it says, "I'm going to store this for the famine." So
Yeah.
when the famine comes, I'm going to protect my
Right.
body,
And the
and it
famine
puts it
never
into the
comes.
liver. Right? It never comes. I can go get a piece of pizza right now, or I can go get a shawarma or whatever, and just eat my arse like whenever and however I want. So there's no famine. I mean, whatever. We'll talk about politics another time. But the fact is that it takes it and says, I'm going to store it in the liver and I'm going to store it in the fat. Okay, because then that's it's stable there, and I'll get it later. What the insulin wants to do is store it in your skeletal muscles. Okay,
Yeah.
because if you exercise, you need to you're using energy to exercise, and the body will say, "Hey, I need to replenish that," and so the body goes and says, the insulin says, "Oh, I'm going to put it to my skeletal muscles, okay, and store it for the next time you're going to need it, and it's not going to go to your liver, and it's not going to go to your fat deposits." So it's and then again, what did our mothers always tell us? Don't exercise after you eat. Don't swim
Right.
after you
Because you're
eat. Don't,
cramp
don't,
or
don't.
whatever.
I'm not telling you to go swimming. I'm telling you to do some sort of 10 to 15 minutes in the hour after you eat. Critical.
Yeah.
That alone can make all the difference in the world. And so just to continue, and stop me if you have any questions on this, but
Yep.
just to continue to the next circle is mental wellness. The
Yes.
next circle is mental wellness. And it should be the first circle, but I talk about mental wellness because it kind of ties into a few other things. And I don't talk about mental illness because mental illness obviously is something that needs to be really addressed, identified, healthcare practitioner, social workers. Everyone needs to chip in on that because it's a critical thing that needs its support. And again, another whole entire
Yeah.
podcast
Mental
on
health. Yeah, for
as well.
sure.
But as it goes in terms of mental wellness, is I want you to try to maintain a mental wellness. What does that mean? Uh, get enough sleep, and it's been very
Yes.
well proven that 7 to 8 hours, who can get 7 to 8 hours of sleep a night, of good sleep, and that means no phones in an hour to 2 hours before you sleep, no phones right when you wake up, because that is shown to decrease your REM, and you're not getting that effective. You're still active in your brain even though you're sleeping, and you're not getting restful sleep. Because one of the things about PCOS is they're always fatigued, they don't have any energy, and they have very fitful nights and insomnia. And so what I try to do is I try to make sure that they're getting good sleep habits and sleep hygiene. So
Yes.
that's another thing. Also, do you know the number one antidepressant in the world? You have it, I have it, no matter where we live, we had it. We've talked about it earlier.
Um,
Sorry to
no.
put you on the spot. It's the sun.
Oh yeah. Yeah.
Okay, the sun,
The early morning
vitamin
sun.
D. Yeah, I mean, if your early morning sun is preferable, but any sun, activating the vitamin D, activating the melatonin and dopamine. So what I try to do is I try to do two of those circles together and say, hey, if you're able to do that exercise outside, that's even better. Get that
Yeah.
outdoor, breathe it in. And that alone could really activate the receptors, decrease your stress levels.
Mm.
Okay, improving your, and then so now remember what we talked about, the adrenal type of PCOS. Now, if you decrease your stress, you're decreasing that type of PCOS. So you're kind of doing things that are multifaceted and multiple pronged approach. So that's mental wellness. So it's like diet, nutrition, exercise, mental wellness, microbiome. The microbiome is we're covered with bacteria, and the bacteria are both good and bad. Mostly good. They're protective. They actually help break down some of our food that we ingest, that we can metabolize it better. But sometimes if you have an unhealthy diet, if you have more antibiotics than you need, if you have, downstream effects, is that sometimes the microbiome shifts. It's,
Yeah.
tens of millions of different types of bacteria into an unhealthy microbiome. I mean, I'm sure you've read about it. You've seen papers on a healthy microbiome versus an unhealthy microbiome,
Right.
and so there are certain types of microbiome, you know, or ecosystems that are actually associated with different diseases, such as cancers, neurodegenerative disorders, Alzheimer's, autoimmune disorders,
Mm.
diabetes, metabolic syndrome, prediabetes, and believe it or not, PCOS, because of
Right.
that whole inflammatory insulin resistance
Yeah.
pathway. It's not like you could just snap your fingers and change your microbiome, but what you can do is that you can institute taking probiotics, prebiotics, symbiotics, improving your diet with sauerkrauts and cabbage salads and more of the what do you call it, vinegar, acetic acid, what am I what's it called? I could see it in my head. Not red wine vinegar.
Oh,
Um,
apple cider vinegar.
Apple cider vinegar. Yeah, I'm like looking at the bottle of my in my picture in my head. I couldn't remember apple cider vinegar, and I take shots of it all the time. And so some of these things can actually improve your microbiome. And then unfortunately, sometimes we gotta go to antibiotics, and they just wipes our antibiotic. It wipes out the good bacteria again. You've got to battle back. So try to don't just go to the doctor and get antibiotics for what you think is a strep throat. Make the diagnosis of the strep throat. Make sure
Yeah.
you're not just calling it in. And unfortunately, with our telemedicine, which is both helpful and harmful, I feel like we're doing a lot of unnecessary antibiotics, and that's doing
Yeah.
damage in a long stream.
It's really easy to call in and get a Z pack, and you're just like, do you need one, or do you just need to get
Right.
your ass to bed? Like, what?
Right.
What?
Yeah. Yeah. And, again, I think that one of our problems also is we're in a very litigious world, and if you don't get antibiotics and you need it,
Yes.
that one out of 10
Right.
times, so the doctor is like, take the antibiotics and call me, call me later. But
Right.
again, so try to do things, learn about your microbiome, improve your microbiome. The next thing I tell my patients is, again, the same thing. As a doctor, I keep getting papers in my inbox, and every magazine, every research article, journal. They talk about these host of supplements that have worked to reverse PCOS.
Mm.
And the way that those are working is that they make your insulin more sensitive. Like, you don't have to have your insulin levels here to get your glucose levels down to the normal levels. You can have your insulin levels here because they're working harder and better. And so I started looking at this from a very holistic perspective and saying, why am I not telling my patients to take these supplements? I don't want to err too much on that side, because sometimes when doctors start going that way, they start like losing the dialogue and narrative and start becoming like this. I don't want to say a quack, but like,
Right.
they stop losing the medical narrative. And so I go through it with them and say why they work, what we're trying to accomplish, what you have to do to be a partner in this is decrease your sugar intake, decrease this, decrease that, and try to like and say, and this is why it's going to help. So after about a few years in my career, I started getting a whole bunch of ideas. Take this supplement, take that supplement, take that supplement. And one time, a patient's father texted me a picture of like 7 supplements that I had
Right.
recommended to his daughter. And I'm like, oh my God, look at that. It must cost you $400 for that. And he's
Mm,
like, yeah, it was 384. And each one of them has data that supports usage in PCOS and metabolic syndrome. And I said, well, that's when the eureka moment. I said, why don't I put this all together? Why don't I manufacture my own? I'll sell it to my patients. I'll go on, I'll open up a site, and each one of them has reasons. So I
oh,
did, and I started selling a supplement that has 11 different ingredients, all tagged for PCOS and type 2 diabetes, because we do know that metformin, which is a medication
right,
for type 2 diabetes, works in PCOS because it makes their insulin more sensitive, dropping insulin levels, dropping LH levels, and then they ovulate. I mean, I'm not dumbing it down. I'm kind of like cutting to the chase
right,
at what
right,
happens. So I started putting my patients on my supplement. I
right.
am telling you, I had a patient who had chin hair. When she's on it, her chin hair resolved within 2 to 3 weeks. Her
And who
acne
doesn't,
improved. Right.
who's like, I want the chin hair.
Yeah, he said it. And then when she couldn't get it because it was out of stock in one store, it grew back and that quickly. And I was like, "This is not supposed to work that quickly." I'm like,
Wow.
"Well, it's actually working very quickly." And so that's that was. And again, you could look at the contents on my site on each one and say, "Hey, that makes sense. That makes sense. That makes sense," because it each attacks this insulin resistance at a different aspect. And then there's some
Right,
anti-inflammatories of the coenzyme Qs and the berberines, red yeast, and so it attacks each type of different, type of PCOS. And then the last circle, the seventh circle, is medication,
yeah,
because if you go on birth control pill, if you go on infertility medication, both of those will work better, I guarantee, if you're doing all of the other pillars. Um,
right.
and and it's like baby steps.
Mm,
The way that I end my discussion with his patients, and I try to do this in a rather quick manner. Um, you're familiar with James Clear, Atomic Habits?
yeah, he's my Bible.
Yeah, it's so incredible. It really is. Everyone should read it. It's mind blowing. So I draw them. I don't know if you remember in the introduction. There's a chart, right? The chart is, and this resonates. I say people think that on the x-axis is time and on the y-axis is effort. If I put this time in and I do this effort, I will hit my goal right here. And they think it's linear,
Yes.
right? They think it's linear. And then after 2 weeks, after 3 weeks, they get discouraged and they're not making any progress towards that goal. And so like 70, 80, 90% of people will fall off. I call that the valley of tears, the valley of despair, the
Yeah,
valley
exactly.
of failure. They think they're not getting anywhere and they all fall off. And they're back right where they started, even worse off where they started, because they feel that they can't accomplish anything in their depressions or whatever, their self-worth and their yeah, and it's so difficult. So I always tell my patients, don't make a goal of whether it be weight loss, a number on a scale. I want the habits to become
Your thing.
indoctrinated into
Yes.
yourself and define who you are, so that when you actually keep doing them, you'll be like, oh my God, I not only did I hit my goal, I passed my goal, and now on to the next goal,
Right.
onwards and upwards. And so, I always give the example of this one couple that I see, like, and every evening they're out. I know they went away and they come back and they're out there again. They're just doing their laps in our block, and
Right.
it's incredible. You always see them out there, and it defines who they are. And so one day I bumped into him on the street and I said, I talk about you, not you personally, but I talk about your mentality in to my patients about how I think of you as an exercise, does such and such. And so it defines him. He goes, well, yeah, I got hurt. I haven't exercised like in 6 months. I'm like, really? And so
Right.
so I actually spurned him to go back out there. And he says, I'm gonna go back out there now. And sure enough, he went back out there. I didn't even notice, because for years I had seen him out there. I didn't realize he was hurt because I hadn't seen him out there for 6. I just assumed he was going at a different time. So I thought that was pretty funny.
So before we wrap up, I wanted to ask like one last question here. Was that, you talked about that PCOS might cause maybe more symptoms for women downstream if I have not been diagnosed. So what are some of the symptoms that I might be experiencing, more than a normal non PCOS
Right.
person.
So first and foremost, the not to say the vast majority, but the majority of patients with PCOS struggle with weight their whole life. Okay, and it's just it's a battle. And they eat, and their friend who doesn't have PCOS or eats the same thing, and she loses weight and she gains weight, and it's very frustrating, very struggling. So they actually have higher risks of depression, anxiety, and mood disorders. Okay, that's documented. They have a higher risk of developing type 2 diabetes, then metabolic syndrome, cardiovascular health is at risk, different types of dementia as well.
Mm,
So, I mean, these things should really make a big difference if people are, people sometimes don't think that far in advance.
no.
But I always talk to my patients thusly, and again, in their perimenopause, it's very important. I tell them that once, and we didn't really get into an estrogen conversation, because wasn't the right time, but I could talk to you again for hours on estrogen replacement.
Yes.
I'm very pro it, for the, right patient, obviously. But what I tell patients is this, and then all of a sudden they listen to me. I say to you, do you know why someone gets admitted to a nursing home? And the top three reasons that someone gets admitted to a nursing home, and then all of a sudden they sit up and they like lean a little bit closer, okay? And you can tell from the body language that they're keyed in. And the first one is dementia,
Yep.
okay? The second one is immobility, and the third one is not being able to care for themselves, urination, their faculties, right? And they need to help. So those are the three reasons. And we do know that immobility is fracturing a hip is from bone loss when they're
Yeah.
not exercising at a younger age, or not eating the right calcium, or not having the right estrogen, not having. And so PCOS, although actually puts you at a lower risk because it's have higher levels of estrogen in their life, but they are at risk for that if they become immobile because of obesity or whatnot. So strength and exercise and strength training and being stronger and having more muscles, and if you have more muscles, muscle weighs more than fat. Okay, so
Right.
don't. I tell those patients, get rid of the scale. I don't even
Yeah.
want them to look at the scale. So and then the pelvic floor. If they're not working on it and doing the exercises as a younger patient, it gets much harder down the road. And then the dementia issue of the patients with PCOS and type 2 diabetes can have a higher risk of developing dementia later on. So they listen and they start making positive changes. And I'm not asking them to build, an Empire State Building overnight. I want them to make small, meaningful changes that actually build over time. That's
Yeah.
all. And that's what I try to impart upon them. And get away from the one pill fix all mentality, because that'll do more damage. That'll do more damage. I'd love to talk to you at length about like Ozempic and if it's good or if it's bad, but I don't, I think we can go down that rabbit hole, because that's a very deep and interesting rabbit hole.
And we'll just do this just a teaser, and then I'm going to bring you back on that one. But there's a doctor out there, Dr. Tina, I can't think of her last name right now, but she's coming at it from a different angle that I think is very interesting. She's coming at it, as you mentioned, inflammation. And inflammation is really challenging for a lot of people to control in their body. And she's looking at Ozempic as a anti-inflammatory versus a pure weight loss. And she's looking at it like inflammation in your brain, inflammation, in your organs, though
Yeah.
that sort of thing, which, you know, if you put that spin on it versus like Kim Kardashian wants to fit into a dress for the Oscars,
Right. Right.
it's
Right.
you're like, so you're just kind
Yeah.
of like you're seeing both sides of it. So
Yeah. Yeah. Yeah.
it's an
Yeah.
interesting
It,
drug.
it it is a very interesting drug. I just, again, to put it very top line, I think it has wonderful, wonderful potential for the right patient. Okay,
Yes.
and to reverse a lot of things that they've been struggling with their whole life. I think that Ozempic babies is a fascinating topic to discuss on how that's happening. These patients who didn't realize they were, able to conceive when they were told they were infertile, and then all of a sudden they're conceiving. I think it's wonderful. I think it's a little scary at times because Ozempic's not approved for pregnancy, but
But it
I
also
always
talks
say
about
this.
what you said, the inflammation, right? So if I've been
Yeah,
like struggling with inflammation and all the steps I haven't been able to do,
right.
shocker.
Yeah, yeah. But again, I wouldn't rely on that one shot fix
Yeah,
all.
no,
I just don't.
agreed. Agreed. But
Yeah,
if
but
you're someone who's, if you've done the
yeah,
steps,
yeah. I just, I'm cautious when something is too good to be true. It often is too good to be true. So I'm a little bit cautious and scary. So I just want to like take some deep breaths, work on the seven pillars. Ozempic may be
right.
that seventh pillar, but just definitely make sure you're doing everything else too.
You're right. It's like you got to nail the basics, right? You didn't just become a doctor. You didn't say, you know what? I think I'm gonna become a gyne today. I get a white coat, and all of a sudden I'm in practice. Like you had to take the steps to get there. And I always tell people, like, you know how like when you get pregnant, and I can't go into you and be like, you know what? I know you said 9 months, but could we get this done in six? Like, I got some
Right.
other things I need done down the line.
No,
You would laugh in my
no,
face
no.
if I said I need this done in 6 months.
Yeah, yeah, yeah. I know. It's just unfortunately it's the mentality that we have to kind of as a society evolve out of. Evolved into it because of technology and we became better at what we did and more efficient at what we did. But unfortunately there's some, there's some broken down cars and carcasses on the side of the road because of it.
Yes,
So we just got,
absolutely.
focusing. Sometimes the path is part of the journey. And it is the journey, not just the end.
For sure. So, I ask everyone when I end my podcast, what's one thing that makes you feel magical?
Um, I think actually patient gratitude.
Ah,
Uh, patient gratitude that it doesn't even have to be much. I just feel like when a patient acknowledges me and says, thanks me, like there was a patient and I went, not that I went out of the way, but I helped her with something, she brought me a bottle of wine and it wasn't expected or anything like that, but just uh, it's very nice to like be appreciated for what I'm trying to do.
hmm.
And or even a patient saying, Dr. Weiss, no one's ever spoken to me like that before. That
Yes.
helps. That's very helpful. And again, I'm not saying anything that you probably didn't know, but just my years of experience have said, I could share with you one thing that happened to me, and I'll end on this. I had I'll leave it up to you, but I was sitting at a wedding once, and this couple sitting next to my wife and myself leaned over to me and said, Dr. Weiss, you saved my daughter's life. You saved our daughter's life. And I don't talk about patients outside of the office. I don't even recognize them. I don't even know who their daughter was. I
Right.
didn't know I took care of their daughter. And I said, if you want to share, please share. I'd love to hear what did I do that was a positive in this woman's life. And so I said something to her about exercising after she ate. The thing that I
Oh,
spoke about earlier.
yeah,
And
yeah.
at that point, it was before I had my polished, seven pillars development story and the whole thing. And I was saying these things and I was just saying, do this, do that, do that, da, 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 and exercise after you eat in the 1 hour. And I said the reason why, and I gave it to her basically as we were finishing up and as she was walking out. That was the one thing that she did and internalized. She lost weight, she menstruated, she got pregnant, she got married. Everything about her life turned around.
Oh, wow.
She was like depressed, and she turned that around, and everything just turned around. And I felt like, wow, my words mean something. And again, not to say that I didn't have it in the past, but it like that was that aha moment. And I like that question of that you just asked. So what made me feel magical? And I really feel like that was a magic moment. And so now I've upped my game in terms of communications with patients.
And it's funny because it's like you never know that one thing you say to a patient. You're
Right.
like, you've
Right.
probably said that tip 1,000 times. And the
More.
fact that like this one person, took in that tip and implemented it, and now like
Yeah.
they have the life, and you're just like, wow, like that is like me.
Yeah. Yeah. Right. Exactly. Exactly. And it reemphasized why I went into medicine, specifically OBGYN and women's health, helping patients with their entire life cycle, and not just being a surgeon for hernia or whatnot or gallbladder, like really seeing these patients over and over and helping them live their best lives and really thriving. And that's what I'm trying to accomplish.
Perfect. Well, thank you so much for your time today. And Magic Makers, feel free to reach out to him. I'm gonna put his all of his social stuff, all of his website on in the show notes. Grab some of his supplements. Like if you're spending $400 a month and you just want it all
Yeah.
in one pill, grab some of his supplements. And absolutely. Oh, do you see patients virtually, or do I have to see you
Yeah.
in person? You see, so he
No,
sees patients.
on our website, probationlife.com, you can order a 15-minute or half hour what do you call it? Visit
Yeah. So
consultation.
absolutely. So if you've been that person who's been that tough to diagnose, like this is your guy. That's his jam, is to help those of you who
Mhm.
are tough to diagnose. All right, Dr. Weissman, as well, Dr. Weiss, sorry. Thank you so much for your time. It has been awesome having you on, and you've just given me, I've been taking notes. So it's been absolutely awesome having you on the show today.
I appreciate it so much, Kim, and just keep up the positive energy. I love the energy. I love the message. I love the momentum. And I know for a fact, you're helping people out there, and keep it up.
Awesome. Thank you.